Hello, good morning. I am State Counsel Dave Fatalla. I'm from the Department of Justice, Refugees and Stateless Persons Protection Unit. I'm from the office, which is primarily mandated to handle persons of concerns, matters or issues. Now, going forward, I would be turning off my camera for internet connection consistency. Fatalla po, sir. Pero it's all right. Common ano yan, mistake na batalya. Anyway, I'm here to discuss with you the whole of society approach in the Philippine context. Next slide, please. Okay. All right. The whole of society approach right now is at the center of the Philippines initiatives for the refugees and other persons of concerns. This is a whole of society approach, this is not a whole of government approach. We need participation both from the government and non-government industries or parties. The key components of this whole society approach is first, engage multisectoral stakeholders, both the government and non-government stakeholders, private sector, academes, civil society, and faith-based organizations, and the POC themselves, or the persons of concerns. Second, build partnerships and foster collaboration at the horizontal and vertical levels. Third, facilitate active participation in decision-making processes, and finally, underpin and highlight complementarity and coordination. Again, because the RSPPU is the primary agency in charge of handling persons of concern issues or matters, kami po, or the RSPPU is the one in charge of or spearheading this whole of society approach. Next slide, please. And this is how the RSPPU is handling it. Next slide. Yung institutional mechanism at the national level. Next slide, please. At the national level, we have the Interagency Steering Committee. This is one of the institutional mechanisms at the national level. Right now, this is an ad hoc body, but we hope that this will be institutionalized through an executive order from the Office of the President or through a law. The objective of the IASC, or the steering committee, is to institutionalize services and policies for the holistic protection of persons of concern. As a state party to the Refugee and Stateless Conventions, the Philippines has certain obligations, one of which is to provide the minimum basic rights for persons of concerns. Right now, the Philippines, I have been told that the Philippines is one of the states which provide more than the minimum under the convention. And this is all thanks to the participation of the different agencies and non-government organizations who provide these services and grant access to their rights. So the 4 clusters in the Interagency Steering Committee is first, the Documentation and Coordination Cluster, composed of the Department of Justice, Bureau of Immigration, Department of Foreign Affairs, and the DILG. Second, we have the Welfare Assistance and Health Cluster, composed of the DOH, DSWD, the Philippine Health Insurance Corporation, and the Philippine Charity Sweepstakes Office. Third, we have the Access Justice Cluster, composed of the Supreme Court, Philippine Judicial Academy, and the Public Attorney's Office. And finally, the Self-Reliance and Education Cluster, composed of the Department of Education, Commission on Higher Education, TESDA, DOLE, DTI, and the Professional Regulation Commission. Right now, this is chaired by the DOJ, and we are being assisted by the UNHCR acting as the ad interim secretariat. Next slide, please. Within the Interagency Steering Committee, there had been created a technical working group specifically to address statelessness. And right now, we had, based on the National Action Plan, there is a move to end statelessness in the Philippines by 2024. The technical working group is focused on the 4 pillars of statelessness, being identification and protection of stateless persons and population at risk of statelessness, and prevention and reduction of statelessness. Civil society organizations are part of the consultations on this aspect, and they have participated, but they are only on an observing capacity. On the part of the DOJ, I think we have, other than resolving existing cases of statelessness, we have been part of projects aimed at reducing statelessness in the, I'm most familiar with the project relating to the Indonesians, persons of Indonesian descent, but I think there are more upcoming projects, but it's a bit complicated and I'm actually not privy to those projects. So let's just move on and skip to the next slide, please. What I have talked about is at the national level, the Interagency Steering Committee. The hope is, of course, what have been talked or agreed upon at the national level will be cascaded down to the local level, which is actually the frontliners who will really implement the policies that were talked about or created. On the part of the DILG, they had issued a memorandum circular number 2020-153 last year. I don't know the specific date, but this was issued to institutionalize the assistance extended by LGUs in line with the state's obligations for POCs to have a fair and equal access to assistance, protection, and durable solutions, especially in the context of emergencies, such as now the pandemic. Right now, the local level is the frontliners, and their participation to protect the POCs is very important because the Philippines do not have any facility, unlike other jurisdictions, which caters to refugees. So we don't have any camps where POCs are being housed. We don't have any facilities for that. So any assistance which will be provided is very appreciated. Part of this memorandum circular, that the DILG stressed the following inclusions for the POCs. Civic inclusion, which consists of assistance in issuance of documentation, promotion of community participation and civic engagement with local authorities and private organizations, inclusive programs, capacity building, and inclusion in accountability mechanisms. And then social inclusion, which gives accessibility to public spaces, access to services, assistance with regard to free legal assistance, conduct of naturalization campaigns. Economic inclusion, support in adapting to the local economy, address structural barriers that prevent full participation in the community, and skills matching. Educational inclusion, which gives them the right or gives them access to education, and health inclusion, access to healthcare services, And finally, cultural inclusion, which promotes multicultural environment. Next slide, please. In providing the assistance to the refugees, the Memorandum Circular states that the LGUs may request assistance from their local peace and order councils to ensure the protection and safety of the POCs. Further, the local and peace and order councils have been granted the authority to create special action committees or task force as may be necessary to address issues or incidents on peace and order and public safety. Next slide, please. Now, what I have mentioned are on the part of the government. Now, on the part of non-government organizations, the UNHCR has, among their many projects, have the Cities with Refugees campaign, but this will be discussed by, I think, Ms. Gamboa later on a later segment. Next slide, please. Oh. These are the other organizations from the private sector that have been tapped or have been participating in this whole of society approach. From the academe, we have organizations which provide education, skills assessment, counseling and training services, research, capacity building, and legal assistance. These are the UP, San Beda, DLSU, Ateneo, and AHRC, which provide legal assistance, legislative advocacy, and capacity building. From the faith-based and civil society organizations, we have the Catholic Bishops Conference of the Philippines, which is also a member of the Civil Society Organization Network on Statelessness. We have the CFSI, which extends assistance to persons of concerns, including psychosocial support, referral to cases to proper authorities, counseling, orientations on their rights and obligations, and others. Then, of course, the UN agencies, the UNICEF, IOM, UN Women, and World Health Organization, which has joint programming, advocacy, and awareness raising. And the private sector, which provide livelihood and employment opportunities towards self-reliance, and finally, of course, the persons of concerns themselves. So, thank you. That would be all for now, but later you can ask me any question on the question and answer portion.